One of the things that I hear from most retirees as they're nearing 65 is, what do I do with Medicare? There's a lot of different parts and plans when it comes to Medicare planning, and there's even a ripple effect with how this can affect your overall retirement picture. Today, I wanted to clear the air by bringing in an expert on the matter. Drew Shockley over from Move Health is one of the premier industry leaders when it comes to health insurance, and particularly Medicare planning. In this video, we'll talk about the different parts and plans when it comes to Medicare, along with implications of IRMA, in addition to other areas that you may want to consider before choosing the right option for yourself. The Medicare decision is a big one, and it's important to know all the information before you make the decision. Let's get right on into it.
Drew, one of the things that I think just at a basic level people need to understand is, what are the different parts of Medicare? There's all these different moving parts. There's supplement programs, there's the basic programs. Like, what are we dealing with here just at a high level?
Yeah, Jake, thanks, man. I mean, first of all, like it's really great to be back with you all again. I'm really pumped to be spending more time, with you and your crew and what you all are doing. I love, how you're bringing healthcare and Medicare planning into your practice, and helping the clients that you're serving. So, on behalf of me and the rest of our team at Move, we're pumped and excited to be here and ready to talk Medicare today.
Right. It's a fun
Yeah,
topic.
It's a great topic. Like, who wakes up every day and starts to talk about Medicare? Well, that's, me. So
This guy, right? Yeah.
yeah, exactly. So I love Medicare. It is one of the things that is consistent across the board when it comes to Medicare. And it doesn't matter if you're like Medicare eligible, or you've already been on Medicare for 10 years, or you're a financial advisor, professional in the space and like trying to help people navigate Medicare, or you're somebody that's upcoming in getting ready to age into Medicare. But one of the things that is constant across the board is confusion. People just don't know. And no offense, most government programs are pretty complex, and there's a lot of things that, don't make sense. But this is what I've been doing for the better half of the last 20 years, helping people understand Medicare. So I'd like to answer your question in parts, or in pieces, if you will. Going back a little bit and giving a little bit of history about Medicare. Medicare's been around since 1965. It's been around for a long time. So it's not a new program, right? And it's been around, every dollar that you make, or like that I make, or like any working American, every dollar that we make, a portion of it goes into Medicare. And Medicare is the federal government healthcare program for a specific group of people. The first thing is, people that are age 65 or older. Obviously, that's like the golden age. Everybody knows that. I'm like waiting. And a lot of people, unfortunately tie their retirement date to 65, and you really don't have to. We've watched that in the other segments that we've done. We've talked about that retiring before. But anyways, a lot of people do that because that's been the age of Medicare eligibility. Most people don't know you can purchase healthcare coverage outside of a job. They think you just have to like work and then get to Medicare at 65 and that's it. But anyways, Medicare's been around since 1965. It's for people that have reached age 65 and or become disabled and unable to work or do the job they were doing for a period of 24 months and eligible for Social Security disability. Okay. So I've helped people in their 20s, 30s, 40s go onto the Medicare program. I've helped an 18-year-old go onto the Medicare program because they were eligible due to a disability. So it's not just people 65, it's people that either 65 or older, or have been deemed disabled and unable to work for a period of 2 years. There are also a lot of conditions that help you become eligible for Medicare right away. So like end-stage renal disease, which is like kidney failure. Typically, if you do like organ transplants or stuff like that, like you immediately become eligible for Medicare. So a lot of people, utilize Medicare, not just people that are 65 or older. Medicare program been around since 1965. Every dollar we make, we're paying into it. Medicare has two main parts to it. Medicare Part A, which is your hospital coverage, A is in Apple, and then Medicare Part B as in boy, which is your doctor coverage or anything that's kind of outpatient, okay? If you worked for at least 10 years or more, you enroll into the Medicare program whenever you're eligible. Medicare Part A provides hospital benefits, and you don't pay a premium for Medicare Part A, as long as you work for 10 years or 40 quarters, or you're married to someone that worked 10 years or 40 quarters. And then Medicare Part B always has a premium. At the time of this recording, 2025, the standard premium for Medicare Part B is $185 per month. If you're drawing Social Security, that's immediately deducted out of your Social Security at $185 a month. And if you're not drawing Social Security, you have to pay that, to Medicare directly. But that's the standard monthly premium, and everybody pays at least the standard monthly premium. And then some people pay more based on income, and we're going to get into that a little bit later. So boiling it all down and kind of bringing in the history and taking 2 or 3 minutes here. Medicare has two main parts. Part A is hospital, Part B is doctor, and you need both of them if you're going to be transferring over.
I've seen people, and we have clients who they try to claim as much of Medicare as they can. By that, I mean, they're trying to just load up like, I need every coverage under the sun to make sure that I'm going to be okay. Most of the time, that doesn't seem really appropriate, depending on who you're talking to, what their health situation is, what kind of prescriptions they need to take. What's important to think about when you are signing up for Medicare, like doctors, prescription coverages, those sorts of things? What's the decision tree that you're walking through with clients when they come to Move Health and they're saying, hey, I've got all these things to think about. What part should I be getting? Should I be getting a supplement? Like, how do you guys think through that?
Yeah, great question. When it comes to a client that's becoming eligible for Medicare, somebody that's making that transition to Medicare for the first time, we have all these letters flying around there. So Part A, Part B, Part C, like what should we do? And again, it's just confusing. But at the end of the day, Medicare clients can be divided into two segments, or really, to say it a different way, there are only two routes you can go. Okay. If you enroll in Medicare A and B, everybody has to do that. If you're not on an employer plan or you're not deferring Medicare to a later date, some people do choose to do that. If you're working to 67 or 68 or whatever you're doing, you might defer Medicare, and that's possible. If you're working and you have an employer plan, you may want to defer Medicare. However, you should at least consider it with somebody. You can call and, obviously work with our team at Move Health, or you should work with an agent and try to consider whether you should stay on your employer plan or move to Medicare. I'll tell you, it's a pretty high probability that moving to Medicare would be a better option for most clients, even if you're continuing to work and on an employer plan, because the first route or the first option for somebody that becomes Medicare eligible, they enroll in A for hospital, B for doctor. The cost for Medicare Part B is $185. The first option, and generally our preferred route, is for that client to enroll in a traditional Medicare supplement, okay? Traditional Medicare supplements are offered by insurance companies. You name them, Blue Cross Blue Shield, Humana, United Healthcare, Mutual of Omaha, whoever it might be. They all offer traditional Medicare supplement plans that are standardized by the federal government. Right now, the most comprehensive Medicare supplement plan that's available is a plan called Plan G, as in George. So if a client is enrolled in Part A, hospital, Part B, doctor, those are both from Medicare, and then they combine a traditional Medicare supplement with any brand name insurance company, and they enroll in Medicare Supplement Plan G, for the most part, people that are turning 65, they're paying no more than $125 a month to be enrolled in that traditional Medicare supplement. Medicare at $185 and MedSup at $125, your client, is around $300 a month, and they have more comprehensive coverage than they would have had through an employer plan. 99% of the time.
And so just as an example, what is Part G, right? And so, I think I could hack my way through giving some high level, but you're the expert here. Like, explain it to me like I'm 5, because sometimes insurance just needs to be explained that way. What is Part G? Why am I not choosing, LMNOP, XYZ? Like, what's the good part about Supplement G?
Yeah, this is perfect. It's really funny, and this is meant to be a joke, so I hope it comes across that way. But Jake, we need to watch your words, okay, Jake? Because there's a difference between part and plan. Okay, so generally, when you're utilizing the word part, like Part A, that's talking about Medicare, like the federal program. Part A and Part B. There is no Part G. There is Plan G, which is in reference to a traditional Medicare supplement. So Part A is hospital, Part B is doctor. If you combine that with a traditional Medicare supplement, Plan G, then here's how that would work. If you were to enroll in Medicare and not enroll in a Medicare supplement plan, you can do that, only having Medicare Part A and only having a Medicare Part B. If you were to go into the hospital and you were only on Medicare, Medicare Part A has a deductible of $1,676. That's the Part A deductible if your client was only on Medicare. That deductible is not once per year, it's actually per benefit period. So Medicare defines their benefit period as a 60-day window. If you go in the hospital, you get out, a new benefit period starts. If you were only on Medicare, you would pay that $1,676 again. So set that aside for a second. Medicare Part B has a deductible of $257. Okay, so this is the federal program, Medicare Part B, going to the doctor. The first $257 is the deductible. After that, if the client only had Medicare, Medicare pays 80% of bills, and the client or the Medicare beneficiary would pay 20% of bills in general. These are their terminology, okay? So if you're only on Medicare, you go to the hospital, you pay $1,676 if you go in, okay? That's the deductible. Medicare Part B, if you go to a doctor, you pay $257, and then you pay 20% of everything, okay? That actually doesn't sound terrible, right? Just on itself, it doesn't sound terrible, but let's slide in. If we had a cool graphic, I would like slide it in, like Medicare Supplement Plan G. Here's what Plan G does. First thing, it pays the Medicare Part A hospital deductible each and every time. Okay, so if the client's on Medicare Part A and they're enrolled in Medicare Supplement Plan G, they go to the hospital, they pay $0. They go once, twice, 3 times, whatever. They pay.
Well, and that's
$0.
huge. That's huge, right? Because as folks get older, like, and that's what people forget, right? It's not just making this decision at 65. Like, we want to make a decision for retirement and make sure we're covered. As folks get older, they go to the hospital more. That's just the reality. Whether it's a fall, a sickness, you just see that more as people get deeper into retirements. $1,600 deductible doesn't sound bad until it's every 2 months, and every time you go to the hospital, it's $1,600.
This traditional route, go in with a traditional Medicare supplement, having Medicare A and B as your primary, and then getting a supplement plan. Plan G is my recommended one. It's the most comprehensive right now. Plan G, when you lay your head down on a pillow at night, you don't have to worry about medical bills. If I need to go to the hospital tomorrow or the next day or whatever, I'm paying $0. And what better way to do it? If you're enrolling in Medicare for the first time and you're thinking about, you're a wealthy individual and you want to protect your assets and you want to make sure you're not putting yourself in a position where your assets are compromised due to health concerns, you need to be enrolling in a traditional Medicare supplement. That's my, our recommendation, from a professional standpoint. So Medicare A and B, A's hospital, B's doctor. If you have traditional Medicare Supplement Plan G, you go into the hospital, you're paying $0. Additionally, under Medicare Part A, there's coverage for a skilled nursing facility. Medicare pays for the first 20 days in a skilled nursing facility. Traditional Medicare Supplement Plan G pays for days 21 through 100. So if you go into a skilled nursing facility, you have the first 100 days paid between Medicare Part A and a traditional Medicare Supplement Plan G. 100 days in skilled nursing. Now, skilled nursing is not just, okay, Uncle Drew is getting old, we need to put him into a skilled place. That's not what it is. It could be went in for a hip replacement, had surgery, you only needed to be in the hospital overnight, and then you can't go home yet because you can't take care of all your daily living stuff, but you need to go into a skilled nursing facility. So people might go in there for a week or 2 weeks or 3 or whatever. But if you have Medicare Part A and you have Medicare Supplement Plan G, you have 100 days in a skilled nursing facility where you don't have to worry about forking out, the $200 or $300 a day that it would cost.
Yeah. And just as a example of this, my Meemaw, and
Okay.
I'll go ahead and admit that I call my grandmother Meemaw. She fell down and broke her hip, right? And was in the hospital for a week, right? And kind of recovering, but then had to go to a skilled nursing facility. So what you're saying, and I won't hold you to the exact specific hospital, the exact kind of care, but if that happens and someone breaks a hip, needs a replacement, but then has to go to, the kind of the physical therapy or a skilled nursing place, that's what it would be covering, correct?
Correct. Yeah, that's a perfect example. So Meemaw, is hurt, sick, she's hurt. She goes to the hospital and then she's stabilized, but she can't quite go home yet. They move her out of the hospital and move her into a skilled nursing facility, right? That's happening way more often than people know. Even heart attack, bypass, you're not in the hospital inpatient for very long. They move to a skilled nursing facility. This is utilized a lot more than people realize. So if you're on Medicare A and B, or if Meemaw is on Medicare A and B and she had a traditional Medicare Supplement Plan G, she would have up to 100 days that would be paid, and she wouldn't have to worry about it. That is unique to a traditional Medicare supplement, and it doesn't work that way in the other option that I'm going to talk about in a couple of minutes. Okay, so Medicare Part A, Medicare Supplement Plan G, go to to the hospital, you pay nothing. Go into a skilled nursing facility, got 100 days, you're squared, it's good. Medicare Part B, okay? So a lot of expenses fall into Medicare Part B. This is going to a doctor, outpatient, specialist, tests, labs, MRIs, CAT scans, everything that's happening outside of an inpatient, situation or skilled nursing falls under Medicare Part B. Medicare Part B has that $257 deductible and then pays 80% of Medicare bills, under Medicare Part B in general. If the client had nothing, the client would pay 20%. From our perspective, this is the most risky part of being on Medicare alone. You would not want to be on Medicare Part B alone by itself, because 20% of every bill, even at Medicare's negotiated prices, could add up. Chemotherapy, radiation, it might be $10,000 for a treatment, and you might have to go twice a week for 3 months. So 2,000, 4,000. I'm from Tennessee, so my math's not great. So you start adding all of that up really quick, and you wouldn't want to pay $20,000 of your bills. So the cool thing about traditional Medicare Supplement Plan G is that once that Medicare deductible of $257 is met, and that's just a deductible that's once a year, Medicare pays 80% of bills, and then Medicare Supplement Plan G comes in and pays that 20%. So it is as easy and as simple and as comprehensive as you could possibly have being Medicare eligible and having a traditional Medicare Supplement, a Plan G, working alongside of Medicare A and B. It's great.
Yeah. And, whenever we talk about these things, even just so far in our conversation, I feel like a lot of these government programs, to some degree, people kind of skim over sometimes the retirement planning, like Social Security, for example, but especially Medicare, it's kind of just like, especially if you're comparing the two, people spend a lot more time on Social Security planning than they will on Medicare planning. But if you look at the actual net benefit, there's probably a pretty equal difference among the two, or could be potentially if you don't plan accordingly. One of the things, though, that still comes up quite often for us, especially when it comes to retirement income planning, Drew, is IRMA surcharges and the impact that they actually have. This is something we talked on a little bit before as we bled into some of the tax planning implications of health insurance planning pre-Medicare. But could you talk a little bit about IRMA surcharges, what those are for people that maybe aren't aware of them, and how they can actually impact the plan? And then even beyond that, maybe what are some of the ways to plan accordingly even if you have some of these in your plan?
Yeah, of course. So, obviously, your firm is a financial advisor firm. You're generally working with, mid to higher net worth individuals, potentially people that have mid to higher incomes. And so IRMA, is an acronym for income related monthly Medicare adjustment. Okay, so this is an impact that doesn't influence or doesn't impact every client, but it impacts a certain subset of clients that have had a higher income in the years leading up to Medicare eligibility. So one of the unique things about IRMA is that it's a 2-year look back. So we're currently, at the time of this recording, we're in 2025. So if someone was becoming eligible for Medicare today, the federal government would be looking at their income from 2023. Okay, so it's a 2-year look back. I mentioned earlier in the segment, Medicare Part B has a standard premium of $185. And so for context today, what I'm going to use for our income bracketing is somebody who's married and filing their taxes jointly. Okay, that's probably the most common, so that's why I chose to use that in preparation for our segment today. So married, filing jointly, if you had an income at or below $212,000 in the year 2023, IRMA is not applicable to you. Okay, so if you're like, yeah, we have a pretty high income, we made $200,000 in 2023. Okay, married, filing jointly, not applicable to you. The first bracket starts at $212,000. And it's about a $50,000 bracket. It goes to $266,000. IRMA, it costs you $74 more a month for your Medicare Part B. So Medicare Part B goes from $185 to $259. Not a big deal. There's a lot of content, a lot of places out there you see like, okay, IRMA is kind of a big deal, sure, but it's not like a reason that you would not retire or something. The next bracket is $266 to $334. That bumps your Medicare premium. It doubles it. It takes it from $185 to $370. If your married joint filing income in 2023 was between $334 and $400, you get a bump of $295. It makes your Medicare Part B $480. If your income was between $400 and $750, you have to add $406 to your Medicare Part B premium, which makes it $185 to $591. And then the top tier IRMA bracket is $750 or above for married filing jointly. And that makes your Medicare Part B premium $628 a month. Okay. In the grand scheme of things, from my opinion, IRMA is not a massive, impact or reason that you would not do something. The top tier pays $443 more a month for Medicare Part B. Okay. So if you're on Medicare A and you work 10 years, the premium is $0. Medicare Part B, the standard premium is $185. And depending upon your income from 2 years previous, you could pay anymore from $74 a month in a surcharge to $443 that year until your 2-year look back falls down into lower categories.
Yeah.
So that's the brief explanation of I wasn't watching the clock, but it's the 2-minute explanation of
I had you at 97 seconds.
Wonderful.
So, and here's a good reason for proactive tax planning, right? There is virtually no reason that someone should be in these higher brackets of income in retirement. I mean, if we're talking top 1 or 5%, it's unavoidable, right? You're going to have assets that produce income that might kick you into here. But if you're doing tax planning the right way, tax loss harvesting gains when it's appropriate, doing Roth conversions ahead of Medicare age, like there's virtually zero reason that you should be in these top brackets of income that's being realized within that year. Because I think that's what people need to understand is it's realized income, right? So we're talking ordinary income from distributions from a pre-tax account. We're talking, income from, high yield savings or taxable brokerage accounts. But if you're living off of Roth dollars, if you're living off of some pre-tax accounts and you've got a taxable brokerage account that you can do some tax loss harvesting in and appropriately harvest gains in years where it makes sense, there's virtually zero reason we should be having $750,000 of income in a year if the tax planning's been done appropriately ahead of time.
Agreed.
And if you're going to have that much income in a year, I would generally say it's because it was unavoidable and you were so far above that limit anyhow that it was going to happen either way. So
yeah, agree. I think many cases it's because of a transaction or because of a sale of a business or sale of a bunch of real estate or something like that. Yeah, it was in general unavoidable. I will say this. There is a process to appeal an IRMA surcharge, and at various times we're able to assist clients with that and appealing an IRMA surcharge if it's a one-time bump, things like that. But in essence, if you do realize or experience an IRMA surcharge, it does fall off. At worst case scenarios, if you had a big year and it was unavoidable, and you file an appeal and it's not successful, then as you fall off, so 26 will be based on 24 income, 27 will be based on 25 income. If you're like, I made $800,000, MAGI in 23, and I'm getting, crushed on Medicare by paying another, $400 a month for my Medicare. That only happens for the period of time until your income falls out of that category. But financial advisors and people that are working, clients, you should be monitoring that and following that and helping people through it.
Yeah, 100%. It's not forever, and maybe it's a little bit more painful. I feel like anytime somebody has to pay a little bit more, even if it's in the grand scheme of things, a smaller number, just feels more of a painful process. But we walk through people and talk through that all the time, especially when it comes to planning and retirement, because sometimes it's somewhat negligible depending on their situation, even if they're hitting some of these marks anyway. But still important to plan for just in case, because again, nobody likes surprises, especially when it comes to taxes and surprises. That's kind of a double whammy, not fun conversation. But again, even if it's something that, for example, if we were to do Roth conversions and puts us in a higher limit for a few years, it's not the end of the world in the grand scheme of things. And that's typically the thing that I'll see online or whenever we have these meetings with folks that come to us and have heard something about IRMA, they're trying to duck IRMA as much as they can in order to, not delay these Roth conversions, but then they have a bigger RMD problem later on, and it's actually a worse tax situation for them in the grand scheme of things. So just to hear it from you, talk through that, I appreciate the context and obviously just your insight on that, because it's a conversation that we have that comes up quite a bit.
Yeah, I think people are overly concerned about it in general. I think there's, and a lot of times when we get concerned about something, it's just because we don't understand it. It's like, oh, penalty, government, more money. You just think that and you're like, dun, 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 like it's going to be the worst thing ever. But even if you're in that top tier, we're talking about, like Medicare Part B standard premium is $185. The top tier is $443 an additional, IRMA surcharge. And it's for that period of time. So, $5,000 a year in additional, Like most of the time, people that are enrolling into Medicare A and B, even if they're paying the top tier Medicare Part B premium at $628, they're usually coming off of Cobra at a job where they were paying $1,500 a month. So it's like they still are like, I'm top tier, and I'm they usually are better. They usually are lower cost and better coverage. And so yeah, I mean, just anytime if you're out there and you're trying to learn about Medicare and you're here on this, the Defining Wealth podcast, like, just encourage you to reach out, to Kyle or Jake or the team, and then just at least explore it or consider it, because it's really not that big of a deal.
Yeah. Yeah. I mean, so kind of moving on from the surcharge territory, and just thinking about this in terms of timeline and planning and all that, when would it make sense to delay claiming parts of Medicare or certain plan supplements? When does it make sense? And are there penalties for that? Do you get increased costs for delaying or not claiming at a certain time? Are there any reasons in your mind? I guess I should ask, are there any, before I ask which reasons?
Yeah, sure. It's great question. So I think that there are some cases and some reasons why you would delay your Medicare enrollment when you have already reached Medicare age at 65, and you have the option to enroll in Medicare. First of all, if you're covered by an employer plan, or let's say you're an executive at a large company and your benefits package is part of your compensation, like, that might be a situation where you would say, hey, I don't really need to enroll in Medicare right now. So you might defer Medicare Part B and continue on the employer plan until you decide to make a transition. So if it's part of your benefits package, from an executive standpoint or whatever, that might be a good idea. A second reason might be you have a spouse that's younger, and you want to make sure that you maintain coverage for that spouse for whatever, a year or two or whatever, and you've explored options outside and comparable to the options through the employer. They're either not as good or they're more costly. That might be a reason why you would defer Medicare A and B, or Medicare B, excuse me. But I would say in the vast majority of cases, when you become eligible, you should explore utilizing Medicare A and B for your healthcare coverage, because generally most people pay less and get better coverage by being on Medicare A and B and having a traditional Medicare supplement. I think, Kyle, Jake, there's a common misconception that Medicare government coverage, Medicare bad. Like, we just generally associate those two things together, and it's really
This
not
is
the case.
America, Drew. Government bad. Come on.
Yeah, I mean, just we generally associate that with having bad coverage, and my employer plan is better. I can go to any doctor, I can go to whatever. And I think that some of this stuff is kind of conflated with what's been happening in the industry over the past 15 years. Okay, so I'm going to bring up kind of an additional concept here. We've only been talking about the first route, or the first option, which I've been labeling and should be labeled as a traditional Medicare supplement. Okay, if you enroll in Medicare A and B is your primary, and you roll in a traditional Medicare supplement like Plan G, that is the traditional route. That is, in my opinion, for mid to high net worth clients, you should be looking at the traditional route. Okay. There is a second option, or another option, that has grown in popularity over the past 15 years, and that's called a Medicare Advantage Plan. Okay, so conceptually, a Medicare Advantage Plan is very different from a traditional Medicare supplement, and I'm going to give you a couple of reasons and a couple of things to remember this. So with a Medicare Advantage Plan, you have to be enrolled in Medicare A and B, just like we've been describing. Okay. But if you want to choose, or you decide to choose or enroll in a Medicare Advantage Plan, you're going to a private insurance company like Humana, United Healthcare, Blue Cross, or whoever, and you enroll in a Medicare Advantage Plan. What happens is the insurance company takes over as your primary coverage for hospital, doctor, prescription, everything. Again, you still have to be enrolled in Medicare A and B, but you would be choosing to receive all of your benefits through that insurance company. Okay? At that point, Medicare becomes dormant, or Medicare does not pay a hospital or a doctor. Your bills are not working like we described earlier with the deductibles and the 80/20 and the blah, blah, blah. It works like a Medicare Advantage Plan works. And so with this type of contract, there's been a lot of growth in Medicare Advantage plans. And if you look anywhere, there's a ton of marketing, and there's a ton of, if you drive around town, a ton of billboards around October, November around Medicare Advantage plans. Many Medicare Advantage plans have $0 monthly premiums. You can enroll in Medicare Advantage plans for $0. And I'm going to explain why, because the transition of responsibility goes from Medicare to the private insurance company. So if you enroll in a Medicare Advantage plan, that insurance company is taking over for you and paying your medical bills, doctor, hospital, drugs, etc. The reason or the way or how an insurance company charges clients $0 is through a process called Medicare capitation payments, which when a
That sounds
client
fun.
I mean, I think it's only 4-syllable capitation. No, it's 4 syllables. So I got that. So it's not really that complex. But, Medicare capitation payments, if you enroll in a Medicare Advantage plan, Medicare takes the money that they had set aside for you and the Medicare Part B premium that you are paying, and they send it to the insurance company. And the insurance company takes all the responsibility on. And so in many cases across all states, across all markets, there's $0 Medicare Advantage plans. And people are like, well, I don't know how they charge me $0. Well, because the federal government is paying them for you to be on a Medicare Advantage plan. So this is a transition of responsibility away from Medicare and away from the federal government and putting it on on the insurance company. With most Medicare Advantage plans, okay, you have $0 premium, but you have anywhere from $1,000 to $6,000 in out-of-pocket responsibility on a year-over-year basis through the form of co-payments and co-insurance. So if you go to the doctor, you pay $20. You go to a specialist, you pay $60. You go into the hospital, you pay $250 a day. You go in to have a surgery, you pay 20%. You go in to do this, it works more like a traditional insurance plan. And a lot of people are attracted to these because of the $0 premium that they see on the advertisement or on the commercial or what they get, the postcard that they get in the mail. On itself, okay, just standing by itself, Medicare Advantage plans are not bad, okay? They have to be as good or better than original Medicare. But from my perspective, a lot of people that enroll in Medicare Advantage plans, they don't understand what they get. They don't understand what they're enrolling in or what they're choosing to do. And the biggest thing, and I'll stop talking after this, the biggest thing that happens when people enroll in Medicare Advantage plans, they're like, oh, I'm healthy now, I'm good, like things are good, I'll just wait a few years, and then, if something happens, I'll go to a traditional Medicare supplement. You can't do that. It's not that easy. When you turn 65 and enroll in a Medicare for the first time, that's the only time that you have the free ability to enroll in a Medicare supplement plan without being asked questions. There's no underwriting. It's guaranteed enrollment or open enrollment or guaranteed issues, what they call it. If you decide to enroll in a traditional Medicare supplement later, 68, 69, 72, I'm going to go on a Medicare Advantage plan for 5 or 6 years. And if I have a bad year, I'll go to a traditional Medicare supplement. It doesn't work that way. This is the most common issue that we work with clients all the time that are older in Medicare ages. They got a Medicare Advantage. They didn't know what they were getting. They start using it. They're paying a bunch of bills out of pocket, and then they want to get traditional Medicare Supplement Plan G, and they can't. That's the biggest pitfall of somebody that's making a decision on Medicare plans, is choosing an Advantage early in their years and wanting to change later, and you can't do it.
Yeah. Well, that's one of the many, many reasons why we have sent a lot of our clients, a lot of our folks your ways, because there's so many moving parts to retirement income planning as a whole, which I always kind of joke, it's like a Rubik's Cube. Just when you think you figured something out, you flip it over and you're like, shoot, everything else is out of whack, or I didn't think about that until it's too late. Medicare and health insurance as a whole is also kind of its own Rubik's Cube set aside that you're trying to figure out simultaneously. And obviously, Drew, you guys are experts at this. Where can folks find you, even if they're just watching this today, whether it be on YouTube or listening to it on the podcast? Obviously, I'll give you the shameless plug. Go at it. You guys are experts at this, and we vouch for everything that you guys do.
Well, thanks, Kyle, and thanks, Jake. I mean, we love working with Defining Wealth and love what you all are building and, providing information to clients, et cetera. So we're happy to be a partner of yours. We have a website like most places. Our website is movehealth.io, M-O-V-E. So movehealth, MOVEHEALTH.io. That is our website where clients can go. You can go there. There's a bunch of resources about Medicare. We have videos. We have different, blogs and posts that we've made, different resources. A bunch of podcasts and other things we've been featured on there. That's the best way to connect with us. You can go there, you can click on the link, you can schedule a meeting with us, or you can go through your Defining Wealth team here. Kyle and Jake can make a connection to us as well. And we love working hand in hand with financial advisors because there's a lot that has to do with healthcare and Medicare planning and your financial plan. I would encourage you, if you don't have an advisor today, you're looking for someone, you're looking to build a partnership, contact the Defining Wealth team and go through their process. I think it'll be well worth your time.
Awesome. Thank you, brother. We appreciate it. This was fun. We got to do this again, and we appreciate your time today. Great insights. I'm sure if somebody was watching this and they're getting closer to that decision, they've certainly learned some things and should reach out to you guys. And maybe they've already made some of those decisions. They're probably nodding their head along to a lot of that.
Yeah,
Hey,
man.
I'm glad to be here. Thank you all so very much. And, we look forward to doing this again.
Well, that's it for today's video. I hope that was helpful for you all. If you'd like to see more videos like this, make sure you go ahead and click subscribe.